What is egg donation and its process?
Egg donation is whenever a patient who is infertile and she comes to us for any ART treatment, for any indication, and she does not have her own oocyte because of some previous pathology, her ovaries has been removed or her ovarian reserve is very less, AMH is less than 1, FSH is high, and she is having a premature menopause. They are the cases where very good candidate for egg donation or oocyte donation.
Who is egg donor?
Egg donor is a lady who is a young lady who should be in between age of 21 to 35 years with a good ovarian reserve, and they are the one good candidate. She should be quite healthy. A screening test should be done. We have to rule out these problems like STD, sexually venereal disease, and also we have to do the screening test for the HIV, hepatitis surface antigen, hepatitis C, virus antigen, and also we have to be sure that she has got a good ovarian reserve by doing the scanning prior to put her on the on-roll for the egg donation program. And she should also have her own family. She should be married lady. These are the candidates, very good candidate for egg donation.
Advantages and disadvantages of egg donation.
Advantage of it is that when you are taking a oocyte from a healthy donor, the success rate of the IVF will improve, and therefore the couple who is coming and asking for the IVF treatment, she will definitely have a good chance for a success. Disadvantage is these egg donors cannot give so many times donation of their egg because they are basically giving egg and selling their egg for the commercial purpose. So this is one thing which should not be encouraged much, but then more than two, 3 times it's not being allowed.
Egg donation is a legal process.
Yes, it is being legalized by ICMR, Indian Council of Medical Research, and ART bill is there. So basically as per that law and the guidelines, we have to move ahead.
Egg donation facility at MHRT.
There are agents who come to us and they are going to other centers, they come to us also. So we follow the guidelines and we enroll them whenever there is any need for any egg donation program.
Risk factors.
If it is basically done in the hand of expert, there should not be any problem.
Egg donation procedure.
It is exactly like when you are taking a self-egg, this is same procedure where the egg donor should be basically enrolled after doing a thorough clinical examination and also doing the thorough screening test, rule out the thyroid problem, rule out all the infection and PID. She has to be basically started on the injection for the controlled ovarian stimulation, and she will be given the injection for about 10 to 12 days. Then she will be given the trigger, basically the HCG, and after 36 hours she will be for the ovum pickup, and exactly then the ICSI will be done with the husband, the patient husband semen, and once the embryos are ready, on the blastocyst phase, it will be transferred to the patient. And of course, on the day of the aspiration, the donor basically can be discharged.
Ethical and religious view on egg donation.
Basically, you are asking whether it is ethical or no, as per the guidelines, international guidelines, and also other religion. It's all very personal issue, and as far as the law is concerned, it's very ethical. If all these guidelines which I told you, she should be married, she should have her own family, she should be aged between 21 to 35 years. So it is allowed.
success stories of Dr. Roya Rosati at MHRT.
About 6 months ago, a patient came. I cannot reveal her name. She came from United Kingdom, where this patient had gone for multiple times of the IVF in United Kingdom, stage 3 to 4 endometriosis. And then she had even gone to Turkey for the IVF, and there also failed. She had a big file, and she is giving a history of the 15 years infertility. So she came in the month of November, and after thorough counseling, because her egg, maybe 1 or 2 eggs we could get, so therefore they came for the egg donation program. And we have taken out her oocyte, the donor oocyte, we enrolled, and after taking out the egg, we could develop 5 good blastocysts. And we had to do the segmented IVF because she was a case of endometriosis, so she has to be on LHRH depot for 2 to 3 cycles. And in the last March, 30th March, we did her embryo transfer today. She is about 13 weeks. She's gone back to United Kingdom, and I have received her message that she has reached happily. She has enrolled herself under NHS for delivery. And I'm very, very pleased to share with all of you that we are the center of excellence. India is the center of excellence. I'm very, very glad and very thankful to all of you, thankful to Almighty God that we are in a position to deliver services to all the needy people.
Yes, ma'am.